Hi, everyone, and welcome to another episode of Caring and Able. Today, it's a very special day for me because not only am I going to be discussing my favorite denture products, I'm discussing it with somebody who I love and respect for many reasons, and we'll get into that. But I'd like to introduce Dr. Lorin Berland to our series. So welcome.
Hey, thanks for having me.
So today we're going to discuss everything you always wanted to know about denture products. And there's a lot of denture products on the market. And my patients will tell you that I always give them one free round of all of Dr. Berland's products. Why? Because they're ADA accepted, which is very important. We'll talk about that later. B, because I think they are superior. And C, because once they try them, they're hooked. So let's get into the meat and potatoes with Dr. Berland. First, I want for our audience to know your background. You're a dentist, but tell us a little bit more about what you're doing now.
Well, first, let me start at the beginning. I come from a family of bad teeth. I come from a family of denture wearers. So dentures were always important to me. I mean, my grandmother used to corner me, and when I was a little kid, and say, if you were a dentist, I'd have all my teeth, because pretty much most of the older people I knew wore dentures, but it was a big deal. They wanted me to be a dentist so that people would be able to save their teeth. And I started out in dentistry, working in a dental lab, making dentures. So then I graduated to working with a dentist when he was doing the wax try-ins and delivering the dentures and processing. And that's when I really fell in love with dentistry and with dentures, because, dentures were the original cosmetic dentistry. You talk about plastic surgery, these little things made out of plastic, they totally transform a person's face, as you know, and everybody who wears dentures know. It changes the entire bottom half of their face. And it just was incredible. So then I decided I wanted to be a dentist. And I went to dental school. I practiced for 35 years. And the last 20 years of practicing, I was developing these dental products because I knew that there were so many advances in home care for people with teeth, but nothing new had come out for denture wearers. And whatever was out there was grossly inadequate. I knew that all the denture adhesives had dangerous amounts of zinc that could cause Alzheimer's, senility, and worse. I knew that the soap cleansers didn't do anything. They didn't kill any of the dangerous pathogens like Candida, strep, staph, actinomyces, E. coli, and these are the major causes of thrush and pneumonia.
Yeah.
So, and then there were no brushes for them. There were no convenient wipes for them. Basically, dentistry has been ignoring these denture patients. So I was working on these different products, and I didn't come up with them on my own. My patients, I was listening to my patients. What do you need? And when they would tell me, I went to work on them. And so I worked on these different formulations for about almost 20 years, and I got FDA approval. And then I did something that no other denture care company did. I got the ADA seal of acceptance. And that's a story of itself. But even then, I wasn't doing anything with the products other than sharing them with my patients and with my friends and their patients. I was still practicing, and then I had a bad bike accident, broke a lot of bones, and that started my new career, Dr. B Dental Solutions.
Okay, well, that's some story. Let's talk about, and I know these products, you could be interviewing me, I know them so well, but I have your products with me.
Oh, great.
I have the first product, my very, very favorite product, the Adhesident.
Ah, yes.
And why do I like the Adhesident? Because my patients tell me when they try it that it blows the other ones out of the water. Tell me what makes it so special. Don't talk about it for so long because we have so many things to talk about, and I want everyone to I want to keep everyone's interest. And I want to go through all the product line because they're so important. But the Adhesident, what makes it so great? And talk about zinc again, because I don't think people understand how dangerous zinc can be in products.
Well, zinc isn't really bad. I mean, it's in vitamins. You need some zinc. But when there's too much zinc, it's been proven that it causes neuropathy, senility, and Alzheimer's. And the FDA noticed that. I noticed that. That's why the stereotype of the denture wearer is like, the grandfather on The Simpsons. It's a doddering old man. And it's kind of like the Mad Hatters of England. They went mad because of all the mercury poisoning. Well, there isn't that much zinc in the adhesive, but when you put it in your mouth and you leave it in there, the mucosa really absorbs it. And what makes it worse is the other adhesives, besides having so much zinc in, you have to use a lot of it. So you'd squish it in there and you'd swallow it. And so the FDA noticed, and 10 years ago, they mandated that they reduce the amount of zinc in their product. And, they did, but they didn't change anything. See, the zinc was the active ingredient that made the copolymer for retention work. So when they took out the zinc, the copolymer didn't work. So we created a new copolymer that didn't need zinc to hold. And, taking the next step, I was developing these products with my patients and their help. And, they all, not all, but most of them, as you know, they suffer from dry mouth. And dry mouth is, besides being very uncomfortable, it's very unhealthy. You need saliva to, flush out the toxins in your mouth, and it's important for digestion. And for a denture wearer, dry mouth is the enemy of retention. Yeah, you can't get a good feel with a dry mouth. So then I decided, well, let's make a moisturizing denture adhesive. It's not just enough to not have zinc. Let's make it more comfortable, and let's make it clean well. So we added some moisturizing, natural ingredients like aloe vera, vitamins A, D, and E, and
Coconut oil.
secret sauce. And we made it so it cleans up better too.
So let me ask you a question. How much adhesive should you use? Brief answer. And how long should it last? Let's talk about it in partial dentures, which means where you have some teeth left, and complete dentures, which means that you have no teeth left. How much should you use, and how long do you expect it? Should you use it 3 times a day, after every meal, once in the morning?
Well, being a dentist, I didn't want I didn't want a 2-day hold or even a 24-hour hold, because hygiene to me is, it's the equivalent of health. They go together. And these things, you don't really want to leave them in your mouth for, 3 consecutive meals. So I really tried to get it to hold for 8 to 12 hours, because I want to really encourage people to, clean their mouths and clean the denture, because, they could be biological sponges if they're not taken care of. So typically I expect 8 to 12 hours. So that said, everybody's different. I mean, we hear people say it lasts 24 hours and they got to pry it out. And then we also hear some people say it lasts 4 to 6 hours. Everybody's different.
How much should you use?
I recommend as little as possible.
So you experiment with it.
Right.
I always tell patients to do dots, like 2 in the front, 1 in the middle, and like a thin line along the back end of it if it's an upper denture, so that when you push it in, it actually seals the denture. That's what I recommend. Is that okay?
That's a great way to do it. As I said, everybody needs to experiment. When I developed adhesive dent, I wanted to work with less. Less is best. But you have to experiment because a lot has to do with how the denture fits in the first place. But I have a video on YouTube how I recommend using it, but other people are different. I recommend you make sure the denture is dry on the inside. You put on the dots, as you said, in the strip, and then you rinse with warm water while you soak the denture in warm water. And that kind of warms and it helps moisturize everything. And then you pop in the denture because we made the adhesive to work well with water because we want the moisturizing effect and we also want the seal effect. Some people do that. Some people spread it with a Q-tip. I just find this convenient because you're rinsing with water and you're soaking it. 10 seconds is all it takes. And typically, from our users, they say that a tube lasts anywhere from 4 to 6 weeks, which
So,
is a lot longer. The competition typically lasts about 2 weeks.
very important questions. Where do you buy it? Where's the cheapest place to buy it? Are there any specials, any codes that people can use? And how much does it cost? About? Is there a range? So talk about that for a minute.
Um, there, most of our products are, with the exception of the Sonic Cleaner, the new ultrasonic cleaner, are in the um, $10 range. We have sales all the time and promotions and specials for recurring orders um, but the best place to buy it is at drbdentalsolutions.com. We have some products on Amazon and Amazon Prime, and we should be all of our products should be on Amazon Prime soon.
That's great. So the best place to buy it is really drbsolutions.com for the best prices. Then you get on the mailing list, and then there's special.
Right. Then you get the best prices.
Right.
And
then if
the benefits are on Dr. B Dental Solutions.
If you're a lazy person like me and you're going to forget drbdentalsolutions.com, you go to Amazon. All right, we got to move on, and you got to talk quicker because I want to get all these questions in.
Okay.
And we need to have briefer answers because people are going to want to know so many things, and I have to ask more questions. So,
okay.
The adhesive sticks in the denture. Now, this is the biggest issue that I have with my caregivers. They want to know, how do I remove it? So I give, like I said, the entire product line to every new denture patient. So except for the Sonic Cleaner, which I'll get into later, but the next product that I give them, a full one, because this is the best product, the Cleansadent, the Cleanadent. I always call it Cleansadent because it does cleanse.
That's a good name.
The Cleanadent. And that removes the denture adhesive as well as cleans your own teeth if it's a partial. It cleans the denture. And what else does it do? It cleans implants. It cleans all kinds of appliances because this is good not just for dentures, but for retainers. So if you're thinking about using this with your grandmother's teeth, you could also use it with your kids' retainers. So let's talk about how does this remove the adhesive, how much it costs. You get it on Amazon on drbdentalsolutions.com. And what makes it so special? And please, brief answers, because I got a ton of other stuff.
Okay. You got to remember, this is my life. This is my mission in life.
I know.
Anyway, it's all of my patients, as you said, they want to know, how do I get it out of the denture? But more important than getting it out of the denture was getting it out of their mouth. Because, it accumulates biofilm, and that's full of bacteria and fungus. And there was no real way to get it out. People give you these cockamamie toothbrushes, these denture toothbrushes that you can't use on anything. And you can't use toothpaste on a denture because it's too abrasive and causes scratches, and it really creates a biological sponge. And that'll cause it to stink and stain over time. So we created Cleanadent paste that's half as abrasive as baby toothpaste, and It's the least abrasive toothpaste on the market, and it's got vitamins A, D, and E, aloe vera, coconut oil, and tea tree oil. And people do love it. That's for sure. And then then you ask, well, what can I use? I can't use those denture brushes because I can't put them in my mouth and I can't use them on a denture. So we created this denture and mouth toothbrush. So you can use it with the Cleanadent paste. It comes in three fun colors, green, blue, and white. And it's extra soft bristles. And it's got special design, like a groove to fit on the ridges. And you can be doing simultaneously cleaning your ridges. You can be cleaning the cheeks, the tongue, the palate, get all that adhesive off, get all the biofilm off. And it's all specially formulated to clean on implants so that if you've got a snap-in denture, it's perfect. In fact, our toothpaste, the Cleanadent, and our brush are the only real utensils, cleaning tools to clean implants on snap-in dentures.
Can I interrupt?
Absolutely.
So
For sure.
I have been looking for the perfect toothbrush for my patients. And even if they don't wear a denture, the fact that it has this ball, which makes it much easier to grab onto, the bristles are so soft, you can clean your gums. People don't realize that bacteria builds up on your gums. So you can clean your gums, you can clean your palate. You could use both sides, even with your natural dentition. And most of all, the grip is amazing for anyone. So when I give it to my older patients, they absolutely love it. And if nothing else, this is the product that everyone should own. If they have retainers, if they have partials, if they have dentures, the toothbrush is amazing. And how much does this cost?
It's in the $10 range.
Okay, fair. And it lasts a while. You could I say put it in the dishwasher. I tell my patients. Is that okay?
Oh, you can put it in the dishwasher, or the best thing is you can put the head in the ultrasonic cleaner with the liquid crystal.
That's
and
great.
As you said, the good thing about the Cleanadent and the brush is you don't have to be toothless to love Cleanadent paste and love the new toothbrush.
Right, because it's more gentle than baby toothpaste. So can you swallow it? What's the danger in swallowing the Cleanadent?
Well, there's no fluoride in it, so there's really no danger.
So if you swallow it,
funny, but while you're bringing this up, when we got the ADA seal of acceptance, they wouldn't give me the ADA seal of acceptance on this at first because there was no category for a toothpaste that's good for dental prosthetics and good for in the mouth. They said this is the first toothpaste that's ever gone for this category, and they said come back in a year after it's been in the market and we'll reevaluate it. And then after it was on the market, they granted us the ADA seal.
Let me just rehash. So we have the Adhesident, which is my favorite product. If I had to choose one, it would be between the toothbrush and the Adhesident that you must own if you're a denture wearer. Even if your dentures fit snugly, this gives you that extra boost that you never have to worry. Then we have the denture, the Cleanadent, which is good for teeth, gums. You could use it if you don't wear dentures. So if you are sharing it with your husband who does wear dentures, this is a great product. There's no fluoride. So if you swallow a little of it, it's not going to hurt you. It removes the denture adhesive from your palate. I won't swear that it works with other products, but it works with the adhesive.
It works with every denture adhesive.
Okay, good to know. So if you love the stuff with zinc and you don't care about the zinc,
yeah, it works.
Your loved ones die, then you can just use this to remove it or get dementia. The toothbrush is amazing. The next product that I give to all of my patients, and I don't get reports on this so much, are the portable Cleanadent wipes. Are they the same formulation as the Cleanadent paste? And can you use the wipes on your own teeth?
You can use them on your own teeth. They're individually wrapped packets, and They're moisturized. They have the same formula as the toothpaste in liquid form. And for denture wearers, they've really been a godsend. That's what we hear, because when they go out, they get food caught under their partial or their denture, and it's embarrassing. Now they can just go to the restroom, um, clean their gums, clean their denture, and throw it out and pop it right back in. And we're hearing a lot of off the shelf uses. I'm hearing from dentists who use it to get stain off after they drink red wine or
Wow.
espresso. And what we've really heard is from a lot of dog owners, and now we use it on our dogs to clean their dog's teeth.
Are you
We
kidding?
never thought about that.
Oh my
before.
gosh, I'm going to try that. And I have to be really honest to everybody out there. I've never opened one. I haven't. I just did for the first time, and it smells like you want to use it on your teeth. It's the most delicious, minty,
It's nice.
spearminty. Yes.
It's
Okay.
very refreshing.
I'm gonna clean my ring with it when I get off. All right. So the other product that I love comes in two sizes. I only brought the large size because I was pretty happy when you sent me the large size. I only have the small sizes. Is the liquid crystal, which I think is a great name, and it's what you put in the ultrasonic cleaner, or you could just put it in a glass to soak your dentures. Should you use water with it? Should you use it undiluted? How much does it cost for the large and small? I want to know everything.
Okay, well, the economy size, it's good for 45 to 50 cleanings. And basically, all you need to do is fill up a cup. And it works, it's a liquid, so it dissolves instantly. It's not like a tablet or a powder that can, lose its strength or start caking. And depending on the water quality, you don't know how it dissolves. This dissolves instantly and perfectly. That's why we made it a liquid. And it's much more effective that way. And you dilute it. It's just 4 pumps and into like a cup of water, or perfectly in the ultrasonic cleaner. And you put your appliance in. And if it's a hard appliance, it doesn't matter how long you leave it in, but everything should be disinfected within 15 minutes, depending how dirty it is at first. And if we also have it in a small size, that's good for about 10 cleanings that you can, it's portable. But it's the only soap cleanser that kills Candida, strep, staph, actinomyces, and E. coli. And, that's the point. Did you know that a denture wearer is twice as likely to get pneumonia or thrush as a non-denture wearer? And if they sleep in their denture, they're 4 times as likely. And why? Because of these dirty dentures. And this is a big secret, and it's very serious. We don't know how many people are suffering and even dying, and they don't know. A couple of years ago, the ADA did a big article on me and these products. And I heard, like, in the first week from 2 dentists, one in New Mexico whose mother had severe stomach problems. No doctor could figure it out. She took her to the Mayo Clinic. It turned out that she had a thrush infection in her stomach. They traced to her denture. And I also heard from another dentist in Seattle who told me that his father died 30 years of pneumonia, and he always thought it was from pneumonia from his denture. And when he read that article, he had to contact me. He says, "This is fantastic." And so what I'm saying is, these are 2 dentists. Who knows about all the people out there that are suffering? And nobody knows. It's their dirty denture.
Well, I'll tell everyone a story. Many of you don't even know that your grandparents wear dentures. And I always say it's the second husband, second wife syndrome, that their new husbands or wives don't know that they wear partials or dentures, so they can't take them out. I didn't know my own grandmother had dentures. I was actually in dental school. I didn't know that she had partials until one day she was very sick, and I went into her bathroom and I saw them in the glass. So, who knows how many people are getting sick from keeping their dentures in, endlessly. Like, maybe they take them out, they rinse them real quick, and they put them back in their mouth, but they're not resting the tissues, which is necessary, and they're not cleansing them properly, which can lead to all of the things that you just discussed. So it's really important, if we're going to give one message to the denture wearers out there, information that you need to know is that you need to let your tissues and your mouth rest for at least 8 hours, and maybe wait for your spouse to go to sleep and take them out secretly and put them in the drawer in the liquid crystals, because it's really important to let your mouth rest and to clean the dentures and to clean your teeth. So now we've discussed how to keep them in.
Can I just add one thing to that?
Yes, you can add one thing.
You know,
Only
because
one.
you know, dentures are my life,
What?
and denture wearers. I'll be very short. A lot of people cannot sleep without their dentures because, and I'm sure you know, the jaw will overclose. They can start having problems in the temporomandibular joint. Some people, if they've got overdentures, you know, the snap-in dentures with implants, if they don't sleep with them, that, you know, the implants, if they have an upper and lower, you know, they could be biting it. It's like a spike in their upper ridge. So, you know, the important thing is, it's not important that they don't wear them when they're sleeping. I didn't want to say that. What you were saying is, what the important thing is, they take them out and they clean the dentures. And the important thing is, before liquid crystal, there really was no effective disinfectant. But still, as you said, they've got to let the tissues breathe. And, you know, you just can't leave them in 24/7.
So let's discuss the amount of time. So you take out the denture. So I always tell my patients to let their mouth rest, but most of my patients, in all honesty, wear full upper, full lower. There's no issues. I have very few people with over dentures, but I do hear you. If you have the spike sticking out of your mouth and you close your mouth, you could, you know, really damage yourself. So yeah, we don't want to hurt you. We don't want you to be hurt. But if you can take them out and let them rest, yes, that's great. If you can't, you want to make sure that they're clean, 100% clean. There's no strep. There's no crush. There's nothing that could cause pneumonia. There's nothing that could cause you to get sick from your own dentures. So the liquid crystal is the first cleaning product that removes 100% of the bad bacteria. Correct?
Correct.
Sparkling clean. And the only way that you can make them even cleaner than just soaping them would be if you used an ultrasonic cleaner. And you know, I love this. I don't want to tell you how I don't have dentures. Or maybe I will tell you. I do soak my jewelry in it, and
you're not the first.
And I do appreciate that Dr. B actually gives you batteries. You know, who does that? And the charging cord, so that you can charge it. The batteries, I guess, are a backup, right? So you charge the batteries,
right? You know, depending where you are, whatever you want to do.
This is a new model. I have the old model, so this is the first time I've seen it, and it's packaged so beautifully. How much is this?
This is, I think it retails for $29.95, and we always have sales on that. Oh yeah, this is definitely worth it. It lasts. It's the first sonic cleaner that there's so many things it has. One, you can fit both top and bottom on it. The other one you couldn't. It's got a timer, 5, 10, 15 minutes. As you pointed out, it's got USB and battery, and it's very quiet. And I forgot what the cycles are, but it really works. There's nothing on it on the market for that price.
Wow. And it's
not even for double the price.
Not even for jewelry. So if your husband has it, don't tell him you're using it to clean.
Well, I have to tell you, you know, I used to always give out sonic cleaners with every removable appliance in my practice. And I can't tell you how many women wanted two. One for their jewelry and one for their dentures. So I gave them two.
You know, I'm telling you this as a friend. You know, I have these in my stockpile, and I give it to the person that has the denture that I'm giving the denture products to, and then the caregiver always asks for one, and I say no. They need to buy their own, because this is not a toothbrush for everyone, even though it is for everyone. I'm too cheap to give it to them, you know?
Okay. Yeah. For
$10, buy your own. But this product is, I'm telling you, this is the beauty of it. I love, and the bristles, why are there 2 rows for the ridges?
2 rows for the ridges? You mean the big head?
Why are there two rows separated? What was the design?
Oh, to work around ridges, to really get the ridge. It wraps
So you
around the
have,
ridge, and if you've got an overdenture implant, it really wraps around. It's very comfortable. If you have that straight bristles, it hurts if you don't have teeth.
right. You could use this on your tongue. You could use this on your cheeks. You could use
And
it on,
also, funny you should say, but that groove in the middle, if you're, and also the small tuft on the top, it's really cool because it actually, there's less gagging and you can brush simultaneously your tongue and your palate. And that, as you know, is so important and very few people do. And those tongue scrapers are extremely uncomfortable. But because of the design of these two bristles, there's less gag reflex, and you do it in half the time.
wow. Well, listen, I love your products. I really do.
Thank you.
I would not have you on my show if I wasn't a believer. And I, honest to God, would not recommend another product because I really truly believe that your adhesive is the best. The liquid crystals are great. The whites, there's nothing like it. I mean, you've really conquered the entire denture industry like no one else, and you deserve a huge spot on the shelves, which I hope you get someday. But if it, until that happens, drbdentalsolutions.com or on Amazon. Do you have anything else, any other funny stories that you want to tell, or what could you add to this conversation that our listeners would get a hoot out of?
Well, I just want to say, this really is the culmination of my life. I've been saying for 20 years, well, actually, since I got into dentistry, since I worked in the dental lab, I said, this is my life. And I'm really glad that I got here.
I think I love the new packaging. I love the colors that you chose. They're happy. And I think your products.
And I'm really gratified by the response we've gotten from denture wearers all over America and Canada. I mean, it made me, I know I did the right thing. I mean, there's
tens
of millions of people have been ignored by big pharma.
That's true. And the products, the ingredients, you can't even, you don't understand. Every one of your ingredients are something you can pronounce, and you know that they are found in nature, which I love.
Well, thank you.
I appreciate everything that you do for my denture wearers. I appreciate the fact that you've taken time out of your busy schedule to be here. And you know how much I adore everything that you teach me about dentures, and you're my go-to person. So thanks again. And thank you all for listening to this episode of Caring and Evil. Have a great day, everyone.
Thank you so much.